Hey there, health enthusiasts and curious minds. Welcome back to the Hub, where we fearlessly tread the uncharted waters of wellness. Get ready for Ketamine, from controversy to cure. The surprising health sides you haven't heard. Buckle up, because this isn't your ordinary health exploration. It's a revelation waiting to unfold. In this video, we're not just unraveling the threads of ketamine's tumultuous history. We're about to unveil a side that often lurks in the shadows of controversy. The side that holds the potential for unexpected health benefits. It's time to challenge assumptions, dig deeper than the headlines, and discover the surprising health narrative that hasn't received its spotlight. So if you're ready to dive into the unexpected, challenge your perceptions, and open your mind to a side of ketamine you haven't heard before, you're in the right place. Don't forget to hit that like button, subscribe for more mind-bending content, and let's begin our journey into ketamine. From controversy to cure, the surprising health side you haven't heard. Ready or not? Here we go. Ketamine is a dissociative drug that inhibits the activity of certain neurotransmitters. An article in Behavioral Brain Research discusses the development of ketamine for use in a variety of medical applications. Kelvin L. Stevens, the American chemistry professor at Wayne State University, was studying alpha-hydroxamine rearrangements in 1962 when he changed the medical world. Professor Stevens synthesized ketamine for the first time, ushering in the drug's long and colorful history. Ketamine, then known as CI-581, was tested on animals after its synthesis, and it showed promising medical potential. Because the preclinical trials for ketamine were successful, scientists switched from testing animals to a controversial practice of testing prisoners in 1964. While scientific testing on human prisoners is still controversial, the 64 testing provided answers as to how ketamine could be used. Ketamine's short action time reduced behavioral toxicity, and anesthetic properties quickly established as it is preferred dissociative anesthetic over bencyclidine. After the FDA approved the use of ketamine in 1970, Americans used the drug to treat several injured soldiers during the Vietnam War. Amputees, gashes, shock wounds, and other severe injuries were common on the battlefield. While these injuries are treatable, seeking medical attention for them is extremely painful, both physically and mentally. Aside from the patient's pain, doctors must work quickly on terrified dying soldiers. The introduction of ketamine provided tremendous assistance to the medical battlefield. Ketamine is not only simply to administer, but it also helps with blood loss, shock, and pain relief. Because ketamine acts as an anesthetic and analgesic quickly, the medical process was improved and soldiers experienced better pain relief and recovery. America and the rest of the world witnessed ketamine's power firsthand due to its ease, efficiency, and incredible pain relief. While ketamine has revolutionary medical properties, many people in the 1970s discovered that it can also be used recreationally. Ketamine abuse quickly spread throughout the United States, beginning on the West Coast and spreading throughout the country. Because of its anesthetic, hallucinatory, paranoid, and trace-like effects, it became a popular rave and dance drug. Ketamine was dubbed Special K, super acid, cat Valium, and vitamin K on the streets. Ketamine, like most drugs, is extremely dangerous without doctor's diagnosis and supervision. When combined with other drugs, it's frequently fatal, and overdoses are common among those who are not educated on ketamine use. When not fatal, ketamine abuse can result in a variety of issues such as liver failure, urinary tract problems, and mental challenges. However, in 2006, researchers at the National Institute of Health discovered that an intravenous dose of ketamine could relieve severe depression in a matter of hours. Doctors have since prescribed ketamine off-label to thousands of depressed patients who have not responded to other medications. In addition, several new ketamine-related drugs are being tested in clinical trials to treat depression. Johnson & Johnson plans to seek FDA approval for its nasal spray esketamine later this year, though the approval would be limited to clinical use only. Meanwhile, doctors have started using ketamine on patients suffering from a variety of psychiatric disorders other than depression, and there is mounting evidence that it can help people suffering from anxiety, bipolar disorder, post-traumatic stress disorder, and possibly obsessive-compulsive disorder. Ketamine has recently become a drug used at crime scenes to assist police officers in subduing violent, resisting, or high-level criminals. Because of its quick-acting and short-acting anesthetic properties, it can de-escalate subjects long enough for officers to approach them. However, because police officers are not given ketamine training, this practice is highly controversial. There have been numerous reports of officers accidentally overdosing subjects and killing them on the spot. Many people believe that officers are killing more people than subduing them by using ketamine because they lack proper training in identification. Many stations are currently debating whether to discontinue the practice. Fortunately, the benefits of ketamine outweigh its criminality. Ketamine is currently a Class 3 scheduled drug use for anesthetic purposes in hospitals and medical settings. When pets and other animals are treated, spayed or neutered, they're given ketamine for anesthesia. In fact, ketamine is the most commonly used veterinarian drug. Ketamine induces anesthesia in humans during, before, and after surgery. It's one of the safest anesthetics available because it does not lower heart rate, breathing rate, or blood pressure like many other anesthetics. It's also commonly used to relieve pain as an analgesic. In hospitals and medical offices, ketamine is one of the most dependable, beneficial, and widely used drugs. Ketamine is absolutely necessary in modern medicine. In fact, most doctors say they can't imagine how the medical world would be without ketamine. Ketamine's many benefits and properties are constantly being discovered by scientists and doctors. Ketamine infusions were discovered in 2014 to provide significant relief to PTSD patients. Ketamine infusions have been used in recent years to treat medically resistant depression, improve anxiety, and significantly reduce suicidal thoughts. Ketamine infusion may provide a new avenue for patients suffering from severe mental health problems by interacting with brain receptors. Today, the incredible benefits of ketamine for mental health patients are making headlines. Ketamine infusions may aid in the treatment of depression, anxiety, bipolar disorder, PTSD, and alcoholism. While this type of ketamine use is relatively new and has not been FDA approved, many studies have reported ketamine success, and many patients have reported finding new hope in ketamine infusion. And there you have it. Daring explorers and inquisitive minds, we've traversed the landscape of controversy, unveiled the mysteries, and dived headfirst into the surprising health side of ketamine, the side you might not have heard about. If this journey challenged your perspectives or left you with newfound insights, don't forget to hit that like button, subscribe for more enlightening adventures, and ring the notification bell so you never miss a revelation. Before you venture back into the realm of your day, I have a couple of questions for you. What aspect of ketamine's surprising health sides intrigued you the most? The mental health applications, the real-life stories, or perhaps the untapped potential we're just beginning to understand? Share your thoughts in the comments below. Thanks for joining me on this eye-opening expedition, and until our next adventure, stay curious, stay informed, and stay tuned.